I'm Kimberly Leonard. I'm a senior healthcare reporter at the Washington Examiner, and I've been a member of AHCJ for I think roughly 5 years now. And 3 of those years I've been the co-chair of the DC chapter, and we have a great big membership there of folks who are covering the White House, Congress, and federal agencies. And we work not only to help put on training for people who are in that area or set up press conferences, but we also do social events. During the past year, we've really started to become more involved in advocating for greater transparency out of different federal agencies. As someone who only covered the last 2 administrations, I've been able to learn a little bit more in recent months and during the last year about ways that federal agencies could become more transparent when it comes to making officials accessible, as well as replying to reporter inquiries. So the DC chapter has really started to become more of an intermediary between the folks in our chapter there and the national chapter in terms of expressing the difficulties that people are having with getting their inquiries and their expectations met in terms of being able to file everything on deadline and report their stories. We have, along with the Right to Know Committee, we helped to send a letter to Health and Human Services Secretary Alex Azar that communicated that we hoped he would open his doors and have the media come in, and so far he really has sat down with reporters, with large groups of reporters, for open-ended questions. And we've also advocated on behalf of individual members when they've been blocked from different calls. And we've very recently sat down with members to say, tell us exactly what has happened to you and how you would like to see your interactions improve. A lot of the panelists today were able to talk about their experiences with building sources within the administration who aren't necessarily the folks who would always talk to the media, but people who have access to a lot of information that's valuable to the public, and they were able to share how they got that information and how they built those relationships. One of the things that I think the Association of Healthcare Journalists is really important for is that our members understand that in numbers we can really make a larger difference. And so if they're able to talk to the leadership about the difficulties they're having, we communicate that, we issue statements on behalf of our members that get a lot of attention, that get their own press. It really is a better way of achieving results. I first came to AHCJ through the conference that I attended, I think about 5 years ago. My first one was in Denver, and I had a colleague at US News and World Report, my former job, who had recommended that I attend the conference, and I went and I was immediately hooked. I think there's a video of me at the time saying that it's like summer camp, and that's really how I feel. But more importantly, it's been a great outlet for me to bounce story ideas off of people. It's been a great place to learn new skills. It's been a great place to develop friendships. And it's been amazing to hear what reporters across the country are doing, because they are doing really fascinating and important work. And to me, being a member of this organization has been an absolute asset in my career. One of the things that I always tell young reporters is I wish that I had joined an association like this earlier, just because of the resources and the networking that's available.